professional activities include planning, designing, implementing, and monitoring clinical trials, cohort studies, and programs for the prevention and treatment of HIV/AIDS and related opportunistic infections globally. He has authored more than 80 publications. He has conducted a pivotal study establishing dose response and linear relationship between adherence to non-nucleoside reverse transcriptase inhibitors-based HIV therapy and virologic outcomes. In addition, he was the first to quantify the savings in healthcare costs per month associated with excellent ART adherence in large South African HIV cohort. He serves as the principal investigator on several research and training grants. He is an ad hoc expert member of the World Health Organization HIV Department, Geneva, within the HIV treatment guidelines, as well as HIV drug resistance working groups. And he's also a member of the South African Academy of Sciences. Please help me in welcoming via Skype. You can see his picture very small on the corner, Dr. G. Nachega.
Thank you, Val. Let me just get started and say thank you to the organizer for giving me the opportunity to speak to you. Can you hear me?
Yes, you're fine.
Can you hear me?
Yes.
Yeah, I was just thanking everyone and thank the organizer for inviting me to speak this afternoon, my afternoon, your morning in the United States. Moving to the next slide, please. So just some of you may be familiar with South Africa. I thought it's good just to give, for those who never been in Africa or South Africa, to give a quick background. South Africa is located at the tip of Africa. So as you can see on the slide, it has 9 provinces. The capital city, the executive capital, is Pretoria, which is in Gauteng province. The judiciary is in Bloemfontein, but the legislative capital is in Cape Town. Cape Town is a beautiful city where I'm, speaking now. It's at the top bottom, where the Atlantic Ocean meet with the Indian Ocean. So again, I'm located there at Stellenbosch University, which is one of the 3 major universities in South Africa, collaborating with Pittsburgh University. I am a Pittsburgh faculty, as Veronica said, and I've been based here to conduct a couple of collaborative research. Next slide. The next slide show you basically Stellenbosch Medical School. The front building is the admin building, and the building in the background is the teaching hospital. So this is the academic hospital. So some of you who may be interested to come to visit me or to work with me, so this is the setting you're going to work. You're gonna work with me. Next slide. So I've been asked just to give a talk on HIV in South Africa, and just allow me to start by just giving you some estimate at what's the morbidity about HIV in South Africa. On this slide, it shows HIV prevalence. So according to the Ministry of Health, in 2011, there was an estimated of about 6 million of people living with HIV in South Africa. 6 million. That's a huge number. South Africa has the largest absolute number of HIV infected in the world. So I think this is quite amazing to document that. And in 2008, the survey I'm showing you here, it's from the Human Science Research Council. It was done in 2008. It was a cross-sectional national population survey which showed that the HIV prevalence was about 10%. And as you can see, it did not change much over the previous years, from the previous year. Not when you see the confidence interval, it seems to be quite stable over time. So this is population-based survey, but I can tell you also we have data about a survey in young pregnant women in that population, which is more sexual active population. The prevalence is about 30%, so quite higher than the population-based survey. So in the next slide, I'm gonna show you some epidemic curve, and you're going to be really amazed how this epidemic is moving in South Africa. So this shows you the prevalence of HIV stratified by provinces. The highest prevalence is about 25% is in KwaZulu-Natal. KwaZulu-Natal is a province in the northeast of South Africa, and the lowest prevalence is in Western Cape. So basically, Cape Town, the city where I'm speaking from, that's where we have the lowest prevalence, which is about 5%, as you can see on the slide. The next slide going to show you basically prevalence of HIV by sex and age group for 2008. It shows basically, first of all, HIV prevalence continued to be high among female compared to male. Second, the HIV prevalence peaks at age 25 to 29 for female, earlier than that of males, which occur at age of 30 to 34. Interestingly, the peak for women remain really high at around 30% for all the three surveys that was done even before 2008. And for men, it peaks at a new high at 25%. So lastly, South Africans older have had 50-year HIV prevalence, with 1 in 10 age from 50 to 54 being HIV positive. This may be a cohort effect, that is people infected earlier now living longer because of antiretroviral therapy. So the take message from this slide basically is to show how the epidemic is affecting badly women more than male, and especially younger women around teenager and young adult. And this is something basically I'm going to come back to it. The next slide. This shows you HIV prevalence among the most at-risk population. So basically in South Africa, the most at risk, which basically going to be the same as in the United States at some extent, is the African female of young age, as just shown you, African male also young adult, male 50 years and older, men who have sex with men, people who are at high risk drinker, alcohol abuse, person who use drugs for recreational purposes, and in some way people with disability. Next slide. It's also interesting to learn that sexual debut by sex among 15 to 24 years old in South Africa over time. So there is an early sexual debut increase, which increased vulnerability to HIV infection among young people, especially females. And then you have, this is important to know, because it's going to also affect in terms of number of young people who are affected, basically going to be in agreement with this behavior data. Next slide. I think something more culturally specific for South Africa, it's the behavior component determinant, which is called intergenerational sex. Intergenerational sex, or some people call it age mixing, it's an important social determinant of HIV in South Africa. One way of determining age mixing is to calculate the age differential. For example, youth who have partner 5 years and older than themselves expose themselves to HIV, as it exposed them to a higher prevalence age group. This slide shows you the rate of teenage mixing sex or intergenerational sex for 2005 and 2008. The findings show that among people who reported having partner who were 5 years older than themselves, there was a substantial increase from 9.6% in 2005 to 14% in 2008. The same pattern of finding were also found among female, and percentage increase very sharply from 18% in 2005 to 27% in 2008. So this is a really important slide which shows some behavior determinant of HIV South Africa among young adults, especially female. Again, look at this really amazing slide which show you the prime source of HIV infection. In red, you have female, in blue, you have male. And as it's shown here, clearly, young female tend to be infected or affected earlier than their counterpart, or their colleagues, the boy colleagues. And for sure, those young female being infected with HIV are having sex with older people, not their classmates, but more older people. And I will let you know later why that is happening in South Africa. So how about multiple sexual partner in South Africa? So this is a survey which tried to capture such behavior. This slide presents data on multiple sexual partner by age in South Africa from 2002 to 2008. Young males tend to have more multiple sexual partner than females, and the rates increase in each survey. In 2008, 5 times more males reported having more than one sexual partner in the past 12 months than their female counterparts. Older females tend to have fewer multiple partners compared to the rest of the group on the slide. The next slide examines the same phenomena by province. So I'm going to try to explain, I skipped the next slide, but let me just try to explain to you this issue about multiple partners. So this is something that is happening in South Africa because of change in value. So next slide. I think we meet. Next slide. This one. So why multiple partner? So this is somewhat related to change in values, normalization of multiple sexual partner as a norm, transactional reason, exchanging of sex for resources. So majority of the population in South Africa live in high poverty. So this makes young female very vulnerable for exchanging sex for resources like, you know,
Dr. Nachega, we've lost your... Sorry.